Hi, everyone. Today, I'm extremely excited to be speaking with Lindsay Mitchell. She's the founder of VitalSide, a membership program that empowers those with chronic illness and limbic system impairment to retrain their brain out of the chronic stress response so they can get relief from their symptoms and find freedom in their lives. Her training in medicine as a physician assistant, work as an NLP practitioner, and experience having recovered from Lyme disease makes her uniquely qualified to assist others in learning how to shift their response and experience positive changes to their symptoms. You can find free brain training tips and tools on Instagram at myvitalside or join her membership at www.vital-side.com. So, Lindsay, thanks so much for being with me and for speaking on this important topic.
Hi, Omar. Thank you so much for having me.
So we've had a good number of conversations recently where we talk about functional medicine and the connection between the physical medicine and the brain and the mind and how those two connect, and between what I do and between what you do. And there's always that very interesting connection between the two. So I want to first start off and ask you a little bit about your journey and your very interesting health journey. So just mention a little bit about that, and then we can take it from there.
Yes. Yeah. I think, well, first off, you coming from your medical background, me coming from medicine as well, we're very much inclined to think the body is one entity. And I think from, one of the reasons why you and I get along so well is we have this understanding that the mind impacts the body, impacts the brain. All three are in communication all the time. And that's something that I had to learn myself, when I was diagnosed with Lyme disease. And at the time, I was experiencing these chronic symptoms. I was getting these migraines. I was having chronic pain, joint pain, pains I had never had before. And I was super anxious, and anxiety was never something that was common to me. I didn't know what it was. I couldn't identify it myself. That's how foreign it was to me. And I was really sensitive. I was having these sensitivities to foods, to my environment, to the things around me. And I realized, okay, something's going on here. I was traveling a lot at the time. I was working as a travel PA. So I, as a practitioner, you never really put yourself first. You're always the caregiver. So I thought, well, it's got to be jet lag. I'm just tired. I started taking naps everywhere I went. My husband's from Ireland, and we spent about a month there, and he has these pictures of me where I'm literally taking a nap on a ocean shore, lying down full asleep, because I was so tired all the time. And of course, this was something that was new and different for me, but when I started to go see practitioners in the States when I got back from my travels and I was explaining to them what happened, a lot of people simply wrote me off and said, well, you're a female. I was in my mid-20s at the time. This is probably hormonal, and you'll just have to wait it out. You'll just have to it'll just kind of dissipate with time. So needless to say, I was written off multiple times, given that whole shtick of it's all in your head and we don't really know what's wrong. So I had studied medicine in outside of Boston, Massachusetts. So in this place where Lyme was pretty prevalent, and I had diagnosed and treated it myself multiple times. And I was bitten by a tick earlier that year. And I just started to put the dots together with my own research, right? And saying, okay, this this is likely Lyme disease. This exhibits all of those same symptoms of Lyme. I ended up going and get tested for Lyme disease, did the Western blot, and then also did a couple other tests, including a urinalysis, and, discovered that, yes, I was experiencing Lyme disease, and I tested positive for some of the Lyme bacteria. And I started treatment. And luckily I ended up meeting, a really great functional doctor who helped me through a lot of the symptoms. But most importantly, he listened to me and he saw who I was. So he took what I said for face value. And, I would say stuff like, this isn't me. I'm not an anxious person. I'm not a sensitive person. I am not myself. There's something else that's wrong. And he was like, I believe you. And so that was just wonderful, right? Forming that, relationship, that trust with the other person. And he and I are good friends to this day, and he's a great referral partner for me. But it was just so validating to get that response. And, I started treatment, and that was good. I had a plan. But after a couple months of using a lot of the treatments and then detoxing and all of the stuff that comes along with, recovering from a chronic illness, I wasn't seeing tangible changes to my symptoms. And so that's when I started to get frustrated, like thinking I'm doing all of the right things, right? I know the trajectory of my treatment plan. I don't understand why I'm not seeing positive physical changes, like actually feeling like I'm getting better, even if potentially, my body is healing. It just doesn't feel that way. Like I'm still inflamed. I'm still anxious, even more so, to a degree, and still getting the migraines, all of these things. So I knew there was a missing puzzle piece, and that's what helped me to connect the dots when I read this blog post on neuroplasticity. And it was written by this young woman who had a similar experience to me. And she said, I started to read about how the brain changes, right? Neuro, the brain, plasticity. So that's malleability, right? Yeah. Change. And I was so excited to learn about this concept that I knew about, like I had learned in school, and as I'm sure you have as well, but I didn't know the application of it. So I didn't know how to apply it to my life. But what I quickly found was that the brain changes when we are experiencing a threat. And it changes the body and how the body responds. And so I'm fighting off this bacteria, and my brain is telling my body there's danger present. Let's respond, right? Let's respond in cytokines and, inflammation. Let's respond in sensitivity in order to help you to become aware that there's a danger present. And so this chronic stress response gets released as a form of protection. But because our brains are so malleable and adaptable and ever-changing, what happens is even with treatment and detox and all of those, quote unquote, right things, we can still be feeling symptomatic, feeling the physical changes of the stress response, even if our body is in the process of healing. And it's a result of this chronic stress response. So I read this and I was like, yeah, duh, right? This makes sense. This is so applicable to my story. And it to me seems like the missing piece. So I started reading, studying about neuroplasticity, and sort of some synonyms for that is, brain retraining, and then looking into nervous system regulation, that brain and body communication. And my studies showed me, well, if you begin to change the signal, sent from the brain to the body, sending it the signal of safety rather than stress. The body responds.
Yeah.
And then vice versa. So getting that message of safety to the body and being able to send that back to the brain. So it's this cycle of, let's communicate this new signal. And it's through specific tangible things we can do through, somatic tools, mental exercises, visualization techniques. So I started doing a whole lot of studying, committing as much time as I could with the brain fog. When you're dealing with a chronic illness, you're like, okay, I can read for about 30 minutes.
Yeah.
But as I started to learn about this and apply those techniques, I started to get better. And slowly but surely, and I remember using a lot of these different tools that I had accumulated through different programs. I was at a crawfish broil, because we're in Texas.
Right. I've never been to one, though, actually.
What did you say?
I've never been to one, actually.
Oh, well, see, you've got to get some Texas neighbors.
Yeah, I guess I haven't experienced all of Texas yet, so.
Hey, this was the one and only crawfish broil I have been to, but probably now for a reason, because crawfish, they're very hard to peel open, and it's just it's a process.
Right.
But it's a novelty. But I went to this crawfish broil, and I would typically say no to going to something like that, because I was so sick, and I hardly left the house, and for a couple months I was bedridden. And I had been using these tools, and about 2 weeks after I started using them, I went to this crawfish broil. And I remember standing there for 10, 15, 30 minutes, and I was like, I'm feeling a sense of ease. I am not in pain, I'm not inflamed, I'm not anxious, like I'm here, like, whoa. I just had this, whoa, like aha moment. And I remember I was 30 minutes in. I was like, okay, that's enough. I'm going to go home now. But that's the evidence for change that I needed. I was able to kind of take in that experience as, okay, wow, things are changing. My brain is changing. My body's receiving a new signal. And now I'm setting myself up to heal. So it took me using a lot of these tools that I had accumulated, that I had personalized to work for me, that some I had created myself. And it took me about 8 months to a year, but well past that year mark, I was traveling, I was eating foods I never thought I'd eat again. Like I thought I'd stay away from gluten and dairy for the rest of my entire life, or never drink alcohol again, or something like that. And I was doing those things, and I was living my life. And when I was well and I wanted to go back to work, I was like, let's get back into medicine. And I knew that this niche was so needed in the chronic illness community and also in the world. Because we live in a traumatized world. We're constantly exposed to, toxins, traumas, all of these different things. And if we can use this process of brain retraining in real time and nervous system regulation on a day-to-day basis, we could be these, superhumans and be adaptable and malleable in a positive way. So making beneficial changes to our brains and bodies. So that's when I decided to start VitalSide and really niche down into that nervous system regulation, brain retraining. And so that's what I've been doing here for the last 5 years, and worked with thousands of people all over the world. It's been just incredible to see changes in people's lives.
Yes, it's such an important story, and thank you for sharing that. I always say that if you were to take medicine back 20, 30, 40 years, then the way that we were practicing makes sense. We're practicing physical medicine in, diagnosis, treatment, very simple, the way that it was before. But I feel like medicine has evolved so much, and partly or mainly due to the fact that we have so many environmental stressors, toxins, as you mentioned, stressors, just the lifestyles that it's become over the last 20 to 30 years, that medicine has evolved, because now you have a significant number of patients that are going into this medical system seeking care, and because of their chronic disease, their particular issues, they're not able to get adequate care. Just like you, because we don't have a system that is set up for dealing with such chronic stressors and chronic illnesses. And so I think that the medical system hasn't really adapted to what you're talking about right now, in more of the mainstream. I've made that decision to go away from the mainstream a little bit, where I'm actually trying to capture these patients that, like yourself, who have gone to practitioners and not been able to find relief. So, really to try to give them more of a holistic, integrative approach to their issue, whatever that issue may be, looking at it from an internist perspective. But still, there is a subset of patients, and that's where we connect, that there's still a subset of patients that no matter how good I get with physical medicine and holistic and integrative medicine, I am just not able to help because of the things that you mentioned, because of this limbic system impairment, because of all of the things that you talk about. And that's that subset of patients that I look to try and help through collaborations like this, where we can create that awareness there that no matter what you give them medication-wise or supplement-wise or diet changes, there is that small percentage that just don't seem to get better. And that's a lot of times that's where, limbic system training and brain training comes into the picture. And so I wanted to ask you more specifically, because I saw one of the videos you had done about the limbic system as a structure and understanding the different functions of the different components of it, and what exactly you mean when you say limbic system impairment. And then we can go to more brain retraining and how that's done.
Yeah, I think limbic system impairment is a term that's been coined within the last couple of decades, and it's made by your history and an understanding, this diagnosis of limbic system impairment. You can make it yourself, really based on the history that you have. So I'll explain what the limbic system is, but first it's worth it to ask yourself a couple questions. So, do I have sensitivities to food? Is it more than 5 foods? Do I experience chronic pain that comes and goes without warning or maybe even a trigger? Do I have anxiety that comes and goes, or maybe panic that comes and goes? Am I hypersensitive to lights or to smells, to my environment, right? So these are some great questions to ask, and it may be worth it then to start understanding, well, do I have limbic system impairment? And it's often something that coincides with a chronic illness, whether it's the diagnosis of an autoimmune condition, chronic fatigue syndrome, Lyme, POTS. All of these chronic conditions often come with this additional diagnosis of limbic system impairment. And so the limbic brain is the feeling, emotional, and reacting brain. It's called the mammalian brain, and it sits in the center of your brain, and it looks like a seahorse. And so some of the meditations I have, you can see it, picture it like a seahorse, and the different structures kind of looking like a seahorse. So one way I like to depict the limbic brain and how it communicates with the rest of the body is through the hypothalamus, pituitary, adrenal axis, the HPA axis. And basically, the hypothalamus is a structure in the limbic brain.
Yeah.
And we're constantly receiving information from our environment. So we receive information through our five senses and also through past experiences. So if our five senses or recognition of past experiences produces a potential threat or a perceived threat, and we perceive that threat again through the five senses, through our past experiences that we've had, or neuroception, kind of understanding that we've experienced danger from another experience. And we perceive that danger, that threat gets recognized. And that's an important part of being an animal, is having this understanding of the threat, and the most primal parts of the brain respond, right? Like the reptilian brain, it responds and says, okay, there's a potential threat. And because the brain, we now know within the last few decades that the parts of the brain are not localized for specific functions. So one part of the brain doesn't only impact one part of the body. The brain, again, is neuroplastic, so changing, malleable, adapting all the time. So it communicates with other parts of the brain. So we perceive that threat. Reptilian brain responds, sends a message, hypothalamus is kind of in that center of the seahorse and says, oh, there's a threat present. Yeah. We need to respond. And the hypothalamus is notorious for sending a message to the pituitary gland, very close in proximity, often thought of as the hormone control center for the body. And pituitary gland gets that message of threat. It says, okay, we need to react, we need to respond, and then sends a message to the adrenal gland sitting right on top of the kidneys. And the adrenals are, among other things, responsible for producing cortisol, that stress hormone. And cortisol gets released to say, okay, we need to react, we need to respond, because we're in a state of survival. There's a threat present. Let's go to war. Like, it's time. And so simultaneously...
Like fight or flight, basically.
Exactly. Exactly. And at the same time, norepinephrine, adrenaline also get released. And so, yes, that's that state of fight or flight. And these neurochemicals are produced in order to help you to stay alive. So you hear words like the fight or flight response, the freeze response, or that immobility response that also is a protective mechanism.
Right.
And you think of an animal in the wild. So an animal that perhaps, it's a hyena running away from a lion.
Yeah.
And that hyena is going to do its best to outrun the lion when it perceives that it's getting hunted. So, flight. It's going to stay and fight if the lion kind of gets it, or there's multiple lions there. It may try to stay and fight.
Right.
And then freeze is that last response, that last-ditch effort of survival.
Yeah.
And that's basically when, surrounded by lions, that hyena can play dead almost, or even just as a protective mechanism, unconsciously go immobile.
Yeah.
And almost play dead, and can be carried to the lion's lair, and maybe the lion goes and gets its cubs, and the last ditch effort is for the hyena to run away. So that immobility, that freeze response. So I use that example of animals because we forget that we're animals. We put on clothes. We drive cars. We're like, oh, we're so
sophisticated, maybe. Yeah.
Exactly. But we are animals, and our instincts are animalistic instincts. So these protective mechanisms that we have housed within the autonomic nervous system, these are all good things. They keep us out of danger. But just like you mentioned, medicine has evolved and changed so much within the last few decades. Technology has changed. What's expected of us as a person in this, Western society has changed. Life events have changed. We've experienced a global pandemic. We've, gone through wars, like all of these things. And not only have we gone through them, but we're exposed more to them with things like the news, social media, the internet, right? So I say all these things because though we're not being hunted daily by a lion, our nervous systems have started to perceive other things are in our environment, in our world, as threats. So like I experienced the bacteria, that I had, along with some other viruses when I experienced Lyme, that was a threat. But also what became threatening to me was food that was like normally fine for me to eat. And then smells in my environment. And all of these other things, right? Social situations, being around people, light, all of these things. And as humans, we do live in more of that sensory overload where we do have threats. Like we drive cars and people stop short in front of us on the freeway and we have to respond and we go into action. Often that's with those protective mechanisms, that fight or flight. But it is not healthy, and it wreaks havoc on our immune systems when we're experiencing that chronic stress response. And that's likely why, you see this influx of people who are relatively healthy. Now
Outwardly.
they have all these chronic symptoms, right? They're not sleeping, they're fatigued, they're brain foggy, and it's hard to pinpoint exactly why. Well, we look at our environment and you can say, okay, well, our nervous systems haven't evolved like technology has, like society has. We're still fairly instinctual, and we need those tools to come back to rest and digest, or growth and repair, that parasympathetic rest and digest response. Accessing that more often than not allows us to be able to connect with our own resilience, our own healing properties, our purpose, our passion, calm, and joy.
We've gone through such evolution in the last probably 10 to 15 years from technological perspective, social media. Everything has really happened. We think that this is just the way that life has been, but it's been this way only for the last 15 years probably. And so it's just been such a rapid shift in the change around us. And so understandably, people haven't, evolved to that, to living those lives. And it's very difficult, the day-to-day lives that we live. So whatever relief we can get in there, we should work on. And then you mentioned the sensitivities and the food sensitivities, the chemical sensitivities. This is, from an MD perspective and someone who's gone through more traditional training, this is very, it's not spoken about too much. It's not really presented to us in medical school or residency training as this is something that you're going to be dealing with out there with patients, and this is how you should respond, or this is what you can do. And so, for me personally, it's been a challenge to try to understand these complex concepts and how to deal with these complex patients. One book I have here is really helped me is Toxic from Dr. Neil Nathan. And this has, been very, he writes about mold toxicity, Lyme's, chemical sensitivities, things like that you were mentioning, and what is a way that we can deal with this, because if you're practicing, you are going to get these patients coming to you, and you need to have solutions for them. And it may not come from directly from yourself, but you need to know then where to send them and how to approach them. And so tell me that when a patient comes to, let's say, me, and they come with a certain complaints like chronic fatigue or fibromyalgia or anything like that, Lyme's even, when we've gone through a lot of the kind of functional medicine treatments and integrative holistic treatments, and they still don't get better, then what is the approach to that patient that you can take, and more specifically in terms of brain retraining that we can do?
Yeah. And I remember being a patient, and I was often called the canary in a coal mine. And if you haven't heard that saying before, it's basically, I honestly hate the saying because I hate being referred to as that. But, you know, basically if you're the one kind of getting sick and almost dying in this coal mine, it's like, you know, there's an issue with the coal mine itself, and you're kind of being plagued with all of these chronic symptoms. And I hated hearing that because I thought, no, I'm a person, and I've had this, you know, yes, toxic overload, but also have experienced this chronic stress response for likely most of my life since I experienced traumatic situations as a child, and this became my primary go-to response. And then at one point my body's like, I can't deal with it anymore. So, you know, that was me. I had gone down the functional route and, you know, really trusted my doctor and had so much hope, but I got to a plateau where I didn't feel like things were changing and that I was actually seeing that physical evidence for change. And that's when this information became so important to me. So as a patient, you know, asking yourself the question, am I ready to be part of my own healing? Because it's likely, like, the work, if you're working with Omar, you know, that he's doing is so great. And if you're working with another practitioner you really like and trust, you know, the work that they're doing is so important. But you can also take part in your healing away from that office visit, at home, throughout the day, while you're driving, before you go to sleep, like in the morning. We can be these key players in our own healing journeys. So am I ready to be an active part of my healing journey? And sometimes the answer is no. You're like, I don't care to do that. I want to outsource my health and healing. And if that's you, that's fine. You're honest with yourself. But I know for me, I was like, it's time. I'm ready. I want to get back to my life. And not only do I want my life back, I want to do some amazing things. I wanted to jump out of a plane. I wanted to, you know, walk across hot coals. I wanted to test my body. I wanted to, like, be my active, adventurous self and eat the foods I wanted to eat and, you know, have a cocktail again, right? I wanted to live my life optimally. And I decided, yes, I want to be that active player in my healing journey. And that's why I created Rewire with the Vital Side membership. And so this is for people who have chronic illnesses and they are struggling. They've gotten to that plateau in their healing journey. And so Rewire is a course. It takes about 2 weeks to go through in its entirety, but you leave with these daily practices that you can address the moment you have a symptom or just throughout the day if you have 24/7 symptoms, and then a longer mental rehearsal that allows you to mentally rehearse the goals that you want to complete and access your natural resilience, that growth and repair response in conjunction with the thing you want to complete. So basically what you're doing is you're training your brain and your body that this food you want to eat or this activity you want to do, maybe it's going to yoga class. For me, it was doing a headstand. That was something that was really important to me because I was always into gymnastics and yoga, and I wanted to get back to doing that. So I did a lot of physical training to get there. Obviously, you don't start with doing a headstand. I could barely lift my hand up over my head, so I started with that. Bending my arm by 60 degrees and then running through this practice, training my brain and body that this movement was in fact safe, that I didn't have to release that stress response in association to this movement. So you do it in a slow, safe, and contained way over a period of time. And then you start to get little pieces of your life back, like more movement or more or less limitations with food, more things that you can eat. I just had someone who had completed a year of using this practice, and she was naming all the changes that she made, and she was like, I also want to mention what my boyfriend says, because it's so nice to get someone else's perspective. And he's like, she smiles more, she's happy, she's present, she's living her life again. And so that was my goal, and that's the goal of the clients that I work with is to optimize your life. What are the goals that you want to do? Again, let's slowly work our way to dial down that stress response so you can achieve the goals you want to achieve. And it does take time. It's not this like I take a pill and I'm done. And
it's a process.
Yeah, this is the magic pill. It's absolutely a process. There's structure to it. You're part of a community. You can work with me one-on-one if that's something you want to do. You can join in on group sessions, but there are thousands of people out there doing it alongside of you, seeing some incredible results. And so it's about choosing every single day. Yes, I'm going to make that 1% difference, right? It's not changing everything drastically day one. It's those 1% small sustainable changes to dialing down that stress response.
Yeah, and that's ultimately the goal, in this practice of ours, is to get those struggling patients and really get them feeling better. And so when we can do that, that's ultimately our aim. And so, I'm so glad you're doing that. And thank you for sharing everything that you mentioned. So we'll wrap up here, and I look forward to having a conversation again on this important topic. So thank you for joining me today.
Yeah, thank you so much for having me.